So, are you good or bad patient? What makes you a good or bad patient? How do you know when you're being good or being bad? And do you care? Does it matter? Today we're talking about the ins and outs of patient care and where you might be classified, and the silliness of being judged as a good or bad patient by your willingness or cooperative nature. Today's day and age, medicine does not want you, as in the past, to ask questions. Overall, they do not like doubt. They do not like that there's any question about their procedures and the dogma with which it's built. So, in a day and age where skepticism is not welcome and questions are not invited and hypocrisy is the stance, which is the patient can't choose, the patient doesn't know any better, this is about all that bullshit and how we want to help you become aware of how to embrace any of those judgments, but to be the best patient you can be in regards to you getting the win, you getting what you need through healthcare rather than healthcare system running you through this machine. Join us for this episode. It'll be fun. Welcome to Frankly Speaking with Dr. Wade. This show is created for and inspired by the thousands of patients I've served, so it's time for me to speak up and speak out on their behalf. With a wide range of experts, we bring you weekly insights, diving deep into topics of controversy to bust through the sugar coating that keeps you and your family stuck in the mainstream. When we're discussing anything with our doctor, the engagement that the doctor has, the views system, the belief set, the mindset that doctor is coming from, he or she, is we have to understand that where their educational background is. And for some of us, we get it's really clear. But as I was meeting with my staff this morning, we talked about a really relevant topic about what makes a good patient. And some of you might feel like, hey, you've might be judged as a patient, and some of you are judged as a patient by your medical providers, by your chiropractor, by your holistic provider, based on your philosophies and how you interact as a patient. And what I'm really getting at is, are you a good patient or a bad patient? As though there's only two types of patients. And I say that because I say it sarcastically because I have an opinion. In other words, there's this mantra or this thought process that in order for you to be a good patient for your physician, you need to follow everything that they say. You need to follow all their instructions. You need to follow let's just say, the vaccine schedule that is not even backed up by all of science, but it's there being perpetuated by lobbyists and standards of care to promote vaccination. Now, whether you believe in it or not doesn't matter, because I'm not here to say you should or shouldn't believe in it. My point is this, is you have a personal health freedom right. And you have a right to determine what goes in your body and not. And some of you don't really care about it, which is fine. Again, that's your challenge, that's your belief, that's your journey, and that's okay. And I'm okay with that as a clinician and a healthcare provider and a primary care provider. But your participation in my recommendations or your doctor's recommendations shouldn't make you a good patient or a bad patient. And I'm going to challenge this by you first to have the school of thought. Where do you think you fall? Where do you think you fall in regards to what kind of patient you are? Are you, in your eyes, a good patient? With maybe you're a good patient in my office with me or with your chiropractor in their office, but you're not a great patient medically. Maybe it's the other way around. You don't really have any respect for chiropractic or anything outside of medicine, and that's where you hang your hat. And again, that's your belief set. But becoming aware that that is your belief set is part of you getting healthier, you understanding your role in health. Every one of us does not believe or feel that or understand that health is an inside job. Many of us are just taught and learned from a young age that drugs are what our body needs, and we're not empowered by how we live, what kind of food we eat, giving our body a chance to, for example, go through a fever and actually enhance the body's immune response. rather than put that fever out with a drug or an aspirin or Tylenol or something to reduce inflammation and fever, when that actually makes it more complicated for the body to deal with the process of fighting bacterial, viral, fungal, whatever it's dealing with. So when we have these various viewpoints and philosophies, you're actually expressing that philosophy in your behavior. And again, it's not judged, at least by me as a provider or clinician, as good or bad. I don't see it as good or bad. I'll give you my criterion for a patient. And a patient in our office that is a good patient is a patient that's breathing. I know some of you are like, whoa, you might want to raise your standards, Dr. Wade. No, I'm really not going to raise my standards. It'd be really nice after this long to not feel like I'm wasting my breath. But I'll give you an example. Have a conversation with a patient. They come to you for help, and the patient says, I want you to fix me. And I get the philosophy, and I get the belief set, and I get where they're coming from. I get that societal has this norm they've painted on, and our expectations are very quick and rapid. Like, Doc, I'm here broken, you fix me. I have this pain, make it go away. There's an easy translation, and it's really about Western medicine, Western philosophy, Western school of thought when it comes to health and healing. The doctor's the healer, the patient is the object. The doctor diagnoses a symptom, or there's no diagnosis, and therefore there's no treatment, because if you don't have a title or a name for it, you can't treat it. When all other parts of the world, there are other philosophies, it's known as Eastern philosophy, or more in Chinese medicine, that your body has many manifestations of symptoms, and the whole of the body is where the energy is focused on restoring balance to the whole and allowing the symptoms to thereby change, but using the symptoms as simply a guide to show or express that the body is out of balance. Western medicine does not want any school of thought there. They do not want to resonate with it. They don't want to hang out with it. They don't want to even acknowledge that it exists, because everything in the U.S. and Western medicine philosophy is that you need drugs or surgery to fix causes or fix syndromes or fix diseases, and or that diseases are treated, not the whole body, not the whole person, not the whole aspect. And that's where I have a problem philosophically. Not a problem or an axe to grind. I just do not see the body that way. I see the body as being a whole organism, that we are physical, we are spiritual, we are biochemical, we are physiological, and we are literally, not to be cliche, but literally, spiritual beings having a human experience, which we're going to manifest discomfort, and we're going to express emotions, we're going to manifest emotions, we're going to feel things we don't always want to feel, we're going to be uncomfortable, we're going to be discomfort. I say that and choose that word specifically because there's uncomfortable, there's discomfort, there's less than comfortable, and then there's this comfort, and there's all kinds of ranges around that. But we're back to talking about what a good patient and bad patient is, and we are judging ourselves as patients, and someone else is judging us as our willingness or unwillingness to comply with all the recommendations or viewpoints, when truly what it is you're not a good or a bad patient. You just either resonate with the answer and the perspective or the advice or the recommendations or the philosophy, or you don't. And maybe you recognize some things like, hey, chiropractic adjustments work great for neck and back pain, but I certainly wouldn't go there when I have the flu, or when I have a sinus infection, or when I have earaches, or when I have blah, 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 or stomach problems, digestive problems, or my bowels aren't moving. And yet chiropractic can influence all those things. And you're going to tell me, if you're listening to this, oh, that's not true, Dr. Wade, you're a quack. Great, have at it. I really don't care. Now, my listeners are typically not those ones, but I know that some people hear this and they just cannot accept that the body and that chiropractic can have these types of responses, because they're still thinking treatment, fixing, back is not connected. And it's like, that is literally the Flat Earth Society. And yes, I have an opinion about it. That's flat Earth. That's flat freaking Earth Society. What else are you so clueless about that you can't perceive that the body is a whole, a representation of the macrocosm in a microcosm, and that all the little cells in your body and the energy within the cells, the atom, the energy of an atom, is the universal consciousness in your cells. There is more of that consciousness than there is matter. So there's this debate, I'm asking the question, as to whether that exists or not. I mean, really? How can at this stage of our game there be this debate about whether people can have the results? I got thousands of patients that have had tremendous results over the last 26 years with chiropractic and nutrition and acknowledging the emotional states that actually can create physiologic and physical changes in the body. And when we release those barriers, those interferences to healing, the patient responds. Whether they think they're a good patient or a bad patient isn't something I need to have. I don't have a spot on my notes and documentation, electronic health records at this stage. Back then it was on a travel card and or a soap note that says star for a good patient, no star for a bad patient. We never had that criterion. But when I was younger and getting into practice, I certainly did have an opinion as to what I thought from some would-be gurus that stated, here's what a great patient is. They might stay, they might pay, they might refer. And unless they stayed, paid, and referred, this is just an example of a mantra, something you're taught that isn't necessarily accurate, but it's a nice wish list that is basically now a judging criterion of whether you're successful in practice or not. Do you have people that stay, pay, and refer? Or are you some loser who their patients get some of their needs met and then they don't come back until they have another need based on their perception of what a need is? So my question for you as a patient is, are you good or bad patient? How do you know? Can you let go of that judgment? And then if you let that go, can you find a provider that accepts you where you're at and doesn't judge you whether you're good or bad, but that you're alive and you're willing to get help and you're willing to ask questions and you're willing to value your health? Because that is something that might hold some weight as to whether you're a good or bad patient, because you're the only one that needs to know where you're at. If you behave a certain way to be perceived as a good patient, by showing up a certain way in your doctor's office, by just complying with a wish that you haven't given any thought and you've abdicated, you've given up that right, you've given that right to someone else to make that decision for you, you have completely put yourself in the hands of Western medicine, the machine of Western medicine that is designed to keep you in that machine and in that system and a resource for that system to operate. Now you might think, is this conspiracy theory? No, it isn't. I'm not here about conspiracy theory. I'm here about capitalism, about understanding the healthcare system the way it is in the United States. If you are being treated for diabetes, and I guarantee the medical model in allopathy is not going to like this response because it disempowers and exposes the directive. But I have multiple patients that come in as diabetics, and they're given information through a dietitian, and a dietitian that's trained through the medical model. And that medical model is specifically teaching that the food pyramid with grains on the bottom is the dietary habits you should be consuming. Now, I don't have to get into the stupidity of that completely, but let me put it really quite frankly. Grains are known inflammatory. Some of you will say, well, I'm not gluten intolerant. I'm not saying you're gluten intolerant. That's not the point. Besides, it's probably not gluten in some cases. It's actually glyphosate within the highly GMO'd gluten. So you may choose to ignore, choose to consider that, or you may still can choose to ignore it and just say that's BS. Fine. I really don't care whether you accept it or not. I honestly don't. Because it's not for you. If you're not willing to open up to information, I can't care more than you do, and I'm not here to change your mind. And what's funny about that is I have colleagues that are so frustrated, and there's a stage in my life when I was early in practice where I poured my heart into it and wanted to really influence and change the world and help people live healthier lives. And I realized I was over attached. I was over functioning. I was overly invested into the outcome rather than allowing people to live their life and choose where they wanted and offer help to those who wanted it and let those who didn't do their thing. Because the truth is, that is how I believe. I believe in you doing what's right for you, by you. But until some people actually hit the ground or hit their deep, low land, their lowest level, they're like, I'm at the bottom and I really need help. They're not necessarily willing or able at that time, or even aware that they need some help or could use some help or could benefit from a change in their life. So in all fairness, a good patient, if there were such a thing, and according to my staff, it would look like this. They're curious. They're open for new information. They're willing to make changes. They value their care. They ask questions and listen to the answer. They actually participate in their health care. What I find fascinating with that's awesome, by the way, is that there's still a lot of judgments as to what our expectations are like. It would make our life easier if our patients were these things. And it's true, it could make our lives easier. But in reality, it's not about us. In other words, my business, my chiropractic office, my healthcare facility is a business, and it's also there to solve a problem. It's there to solve a problem in my community. It's there to solve a problem to the challenges that our community is exposed to. And it's exposed to a world that literally, I just saw a statistic back in, I think it's March or January of 2019. It's not that old. But literally, pharmaceuticals spend $20 billion in advertising last year alone. $2 billion is on social media to market drugs. So they can completely outnumber and outfund any other directive at educating a patient as to alternatives to the mainstream model. So you've got this huge economic engine that's driving people into the machine and keeping them in the machine, allopathic care, that moves people through this machinery as a societal norm with no other alternatives, downplaying anything outside of that as non-scientific or pseudoscience, and censoring wherever possible to not allow information to be disseminated in an alternative or controversial or varied state other than what pharmaceutical companies, the mainstream allopathic model, wants consumers to know. Fear drives the engine. Fear drives your behavior, whether you like it, love it, or not. This is a tangent off a good, bad patient, but it's still the same conversation. Because if you don't follow your doctor's recommendations, you will get categorized, as many of my patients have shared with me. But there's more than I'd like to admit. Their doctors, medically, have kind of classified them as complicated or red flagged them as patients because they ask questions and they don't do everything their medical doctor says. So all of a sudden they're disgruntled. They're a challenging patient. They're problematic and they want them out. When really, if patients ask questions, it tells me they're engaged. It tells me they're engaged in their care. They want to know more information. They want to participate. They want to know my opinion. They want to know what I have to back it up. And actually, I don't mind it at all. I don't love 21 questions. And ultimately, there's my time is valuable. But that's why this exists as a podcast. Because I've said the same things over and over and over for years, and patients have predictably repeatable questions. So let's find a place to put those answers and or discussion and or dialogue and allow some answers to be distilled out of common sense and logic and not just an off-the-cuff, flippant response by a medical doctor who just shared with a patient the other day, an ENT, shared with my patient when my patient is in his mid-60s and very experienced man and has had care for years and benefits from care and has had great quality of life as a result of getting adjusted. And he shared with his doctor, you put me on this medication for my sinuses and my nose is bleeding now profusely. Well, you better stop that, then the doctor said. He said, well, how come you prescribed? He said, well, that's not a good response. How long has that been happening? Well, this is about the 7th or 8th time it's happened. I'm not sure exactly how many. But then it was like, whoa, we have to pull you off that. That's not good. And when I was a kid, I was shared with this from my mom. She said when I had some chronic sinusitis, and I used this spray, and I think back then it was called Nostrilla. It was a nostril spray to help open up the passages. And what she warned me against is, Wade, you shouldn't be using that, and you shouldn't be using it so much at all, because it actually thins the mucous membranes. In other words, it makes the lining of the epithelial tissue in your nose, the outer tissue inside the nose, thinner to where you have a greater propensity to bleed, and then that can happen long term. You can change how your body, and in his case, this particular patient had to get it cauterized. Yes, they had to literally laser close the chronic profuse bleeding that was going on up in his sinus cavity in his nose. So we have drugs to thank for that. And some of you are going to say, well, drugs are good in many ways. I'm thankful that if I break my leg or have a heart attack, I'm going to the same place you're going to. But they're not going to advise me on long-term health goals. I'm not going to take a long-term drug that they say is going to benefit my health for various reasons. And I've had some health issues where I've made those decisions, but I'm the one making them based on information, not just random, I don't like it, so I'm not doing it. And I don't give that kind of advice to my patients either as a caveat. I support my patient's choices. But this particular patient shared with his ENT, hey, doc, every time, when I get adjusted, not every time, but when it shows up, my chiropractor says, hey, how your sinus is doing, because this area right here, and he points to it and it's very tender and off, he adjusts it and my sinuses get better. And then if I've had any stuffiness or sinus infection, my body literally heals it and it helps. And his ENT looked at him in the face and kind of moved in close, kind of like in the personal zone, and said, that's bull crap. And so my patient kind of stepped back, eyes popped out, and he's kind of like, wow, how do you even make me a liar? I mean, just because you don't like the chiropractor, you're going to say that that's false because you can't accept it and you don't believe it, and your science doesn't teach you how neurology is connected to the spine, and everything, all the nerves that supply organs, tissues, and cells come through the spine, from the brain, through the spinal cord, and communicate with all those cells back and forth on a two-way street, like a two-way highway. So all of a sudden, I just laughed. It doesn't offend me one bit because I know the mentality. I don't respect it by any means. The sad thing is the patient had to choose, and he told me right there, he said, I'm not going back to him. I fired him. I'm getting a new ENT. And honestly, that's what you should do as a patient. And I would expect nonetheless if I did that to a patient. I'm a patient advocate. I work for them. I work for you as a patient. My job is to support your choices. I can disagree with them, but I still respect you and support you in your decisions, which is why you can be a great patient and not comply with all my recommendations. If I find I'm wasting my time and I'm wasting my breath, you have 30 questions, 21 questions, 10 questions, I answer them all, and you still just keep asking questions and not do anything different, at some point I'm going to say, look, you're really not doing anything I'm saying, so this is probably not a good fit. You want me to refer you somewhere where you might feel like it's a better fit. But usually that kind of takes care of itself in light of a patient's philosophy. I try to match that up right away so they know, so they're in the right place and that I'm not wasting my time with them. If their philosophy is more that, hey, they just want to come in and get adjusted, crack, pop, boom, they're good, symptomatically, and really not address any causes of the problem or support it with stability care, health care, reconstructive, where they're actually making changes long-term to improve this, I'm okay with that. I'm not judging them. It just may be that they're going to be a better fit in another office, that the focus is just pain and symptoms. So what I'm really trying to state is that you have permission, not from me, but an acknowledgement. I just want to confirm that you are the decider and you are the decision maker in your healthcare choices, and that if you're not choosing your doc, which will come up in another discussion, is how to choose your doctor, how to know when you need to choose a doctor. How do you go about that process of either changing or getting or finding or seeking? Where do I start? What am I looking for? What kind of questions should I ask? How do I know that I'm going to be creating a good relationship with my doctor? The saddest thing that goes on is that you don't have a long-term relationship with a doctor anymore, whether it's a chiropractor, whether it's a physician, a medical physician, whether it's a pediatric doc or an OBGYN, or whether it's somebody that you've worked with and knows your history, understands it, and takes the symptoms you're having in the context of your patient history, and not just like going to the ER or urgent care. You have symptoms and they got to rule out all these things every time because they don't know who you are. They don't know you from Adam. They can't always find all your records. And so in the meantime, they just got to CYA, cover their ass, cover your ass in terms of what they do to then make sure their liability is low and that they're doing the right thing by you from an emergent or urgent care standpoint. Tongue twister. So are you good or bad patient? What makes you a good or bad patient? How do you know when you're being good or being bad? And do you care? Does it matter? All these are just topics around a judgment that's either given to you by medical offices and providers, or you give yourself as a result of how you think you're behaving in response to what's being directed or advised. Are you a bad patient because your doc says you should take a statin drug and you say, "Doc, I don't want to do that." And every time he says you need to, or a heart med for blood pressure, or some other form, let's say it's a digestive reflux med, and because he's the doc, you've empowered him, you just say, "Okay, good, I'll do it." And that way, it is true, it is easier. You don't have to change anything. But if you ask questions, or you're a mom or a dad or some parents that go in for their child's checkup and they state, "Hey, we got to catch up little Johnny on his vaccine schedule because he's off and he needs pertussis, he needs the DTaP, he needs the MMR, he needs the flu shot, he needs the chickenpox vaccine, he needs all this stuff, he needs the tetanus." And you say, "You know what, Doc, I'm going to just wait because we're still researching. We heard that, a friend of ours had a reaction, da-da-da." And it's like, well, that's not true, number one, and you're opening the risk to your family, and that's not good parenting, so we need to do this today. And you are going to be judged as a bad patient and maybe even dismissed. In fact, it's recommended that you get dismissed nowadays and that you don't get the care you need and you don't have access until you comply like a good, quote-unquote, set of parents would do and get your child to jump through the hoops that medicine says are absolutely necessary for the livelihood of the population as well as your child, and that everyone needs this to survive in this world today, which is absolute hogwash. But again, that's an opinion, and it could be right. In fact, it's backed up by thousands of years of history, and yet pharmaceutically derived information will purport and drive you that the reason we have any health today is because of them. So anyway, that said, there is a lot to discuss. There's a lot of varying opinions in this. So I hope you can discern whether you're a good or bad patient, and that you realize that it's just a tag you've given yourself or someone's given you. And I don't want you to feel scorned, bad, judged, guilty for asking questions to your doc and for having concerns and skepticism. Should you make everything a question? I don't know. That's up to you. Do you have to be difficult? Can you allow someone to have an opinion? And do you have to have all the answers before you take action? Or do you need every answer and absolute certainty? You're all going to come in with different levels of this. Some are going to completely abdicate and say, "Hey, doc, whatever you say I need to do, I'll do." And others are going to be so questioning on one end of the spectrum that you won't do anything, and you'll have analysis paralysis, and you're going to ask 10 docs, and you're going to get 7, 8, 10 different opinions, and now you're going to be really confused. So you're going to go back to Dr. Google, and Dr. Google's going to spin you in a direction to this person's website to sell you that product, and this person's website to sell you those products. And now they all have differing opinions, and so you throw your arms up in the air and go, to hell, that the world's a nasty place. Everyone's trying to sell me something. It's exhausting, isn't it? I agree. Be logical. The next podcast is going to be on foundations of health and healing and giving you resources to root deeply into the ground so you have a solid, stable standpoint upon which to build information from thereafter in how you actually start or recover or rebuild for health, and then logical, pragmatic approach, cost-effective approaches to staying healthy and continuing to become more independent of the U.S. mainstream model of healthcare that is this perpetual machine that does not let you out once you're in it and wants those healthcare dollars to stay churning in that machine. Hopefully you found some value in this, if none other than to just ask some questions about where you might lie in, and I mean like where you might lay or lie in position versus lying, telling stories, fibs, lies. Oh, that was confusing, wasn't it? I just left it in there anyway. In regards to where you are positioned in the spectrum of asking questions and being active as a healthcare consumer. And are you using good judgment? Are you using poor judgment? Are you duped by fear? Is fear driving all your behaviors? These are things that we're going to discuss to more expose your own health philosophies so you can either continue with them or tweak them along the way to suit you and your best self. Till next time, my friends. Peace. Ciao. Thank you much for listening to this week's episode. I look forward to any feedback and or questions you might have. Direct them to our Facebook page, Frankly Speaking, Dr. Wade at Facebook. Okay, my fellow health warriors, it's time to head over to iTunes, franklyspeakingdrwade.com. There, you can rate, review, and subscribe, as well as share so more of our brothers and sisters can grow to realize their voice. Speaking up means you matter. So, get on it. This podcast is for information purposes only. The statements and views expressed are not medical advice and are not meant to replace the medical advice of your doctor. This podcast, including Dr. Wade Anderson and his guests, disclaim responsibility for any adverse effects you may experience from the specific use of information contained herein. Opinions of guests are their own, and this podcast does not endorse and accept responsibility for statements made by guests. This podcast does not make any representations or warranties about the guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for such services or products. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.